Let's discuss spleen chi sinking or center chi fall. This is due to spleen chi deficiency failing to raise chi upward, leading to chi sinking. It is also called middle jiao chi sinking pattern. Key symptoms: bearing down sensation in the abdomen and prolapse of internal organs with symptoms of spleen chi deficiency. Clinical manifestations: these include bearing down sensation in the abdomen, distension in the epigastrium and abdomen, especially after meals, frequent and urgent defecation, and chronic diarrhea, a bearing down sensation of the anus, prolapse of the rectum or uterus, and turbid urine. These symptoms usually are accompanied by shortness of breath, lack of strength, lassitude, and laziness in speaking, dizziness, lusterless, whitish complexion, poor appetite, loose stool, a pale tongue with a white coating, and a moderate and weak pulse. Analysis. This pattern is mainly caused by further development of spleen chi deficiency, by chronic diarrhea or chronic dysentery, overstrained fatigue damage, or by excessive childbearing and improper nursing care after childbirth, all of which consume the spleen chi. Analysis of the spleen chi sinking pattern. Failure to raise chi will lead to bearing down sensation and distension in the epigastrium and abdomen, especially after meals. Failure to keep the organs in their place will lead to frequency and urgency of defecation, a bearing down sensation of the anus, chronic diarrhea, and prolapse of the rectum or uterus. Sinking of clear chi, refined nutritive substances transmit to the bladder will lead to turbid urine. Clear yang qi failing to rise to nourish the head and eyes will lead to dizziness. Spleen qi deficiency failing to transport or digest will lead to poor appetite and loose stools. And qi deficiency will lead to shortness of breath, lack of strength, lassitude, laziness in speaking, lusterless and whitish complexion, a pale tongue with a white coating, a moderate and weak pulse. To summarize, center chi fall or spleen chi sinking, the etiology is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, standing for long hours every day, childbirth, menopause, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: spleen chi deficiency, stomach chi deficiency, lung chi deficiency. Signs and symptoms: poor appetite, slight abdominal distension following food, pale complexion, tiredness, weakness of the limbs, loose stools, depression, tendency to gain weight, bearing down sensation in the abdomen, prolapse of stomach, uterus, anus, or bladder, frequent and urgent urination. In infants, depressed fontanelle. Pulse empty or weak. Tongue pale. Treatment principle: supplement the center and boost chi, raise yang, and rectify the fall. Acupuncture treatment: REN 12 and stomach 36 and spleen 6 will supplement the spleen chi. Spleen 3 is the yuan source point of the spleen. Bladder 20 will supplement the spleen chi in chronic cases. Bladder 21 supplements stomach and spleen chi. Do 20 raises the chi. REN 6 supplements and raises chi. Stomach 21 supplements the stomach, rectifies prolapse of the stomach. Do 1 for prolapse of anus. Needle with supplementation and moxa. Relevant advice: as well as following the advice that is recommended when there is spleen chi deficiency, it is important that the patient avoids heavy lifting. Thank you for your attention.